Good morning, friends, and a warm greeting to you all from the US during this International Nurses Week celebrations. Thanks for the kind introduction. I'm deeply humbled by it. And thank you, Professor Maheshwari, the principal of Army College of Nursing, Jalandhar Cantonment, for inviting me to be a part of your celebrations, especially the international webinar on nursing is a blessing. She's also my classmate and my dearest friend from the College of Nursing, AIMS, New Delhi. First of all, let me congratulate you all for choosing this profession. I want to let you all know that you are in such a noble profession, the most trusted profession in the United States for the past few years, according to the poll. I truly believe that nursing has to be the most trusted profession all over the world because we touch the lives of people. We make a difference in their lives. It is because there are no people in the world whose lives are not touched by the care and reassurance that nurses provide continually, every hour of the day, every day of the year. The pandemic situation has a greater significance on International Nurses Day than ever because we nurses rose to the demands of the world by continually providing selfless services to the patients. The theme for this year's Nurses Day is Nurses, a Voice to Lead, a Vision for Future Healthcare. This gives great hope to all of us, the veteran nurses as well as emerging nurses like you all. Have you ever thought of becoming a voice to lead? The truth is, we as nurses have showed our strength in leadership during this COVID battle through innovations, technology, policy and practice changes, preventive medicines, and telehealth. That is exactly why we define nursing as an art and a science. I know you all are familiar with the story of Florence Nightingale, the founder of modern nursing. She was the first innovator in nursing. She realized that the lack of sanitation and hand washing were the major causes of death of wounded soldiers during the Crimean War. And what did she do? She took innovative steps to resolve those issues. And what was the end result? The death rate of the soldiers was drastically decreased by 2/3. I'm sure you all have had enough lectures and presentations on this theme during this past week. And your principal ma'am has specifically asked me not to give you a lecture, but share my experience during this COVID pandemic. I definitely can share my experience to you because I was working on a COVID unit for the past 1 year. So the unexpected outbreak and the drastic measures that were required to contrast the COVID-19 pandemic have rapidly changed our personal and professional lives. The lockdown and the social distancing measures enforced by governments, it heavily affected our private life and our professional life. Initially, we saw resistance from the people to wear those masks in public places. We saw protests against healthcare workers, claiming that we were spreading false fear about this COVID virus. We saw hesitation from the public to follow the guidelines from the health authorities. But as time passed, the truth prevailed over all emotions and hesitations and actions. For the first time in our age, after the Spanish flu, we have heard stories about it, but this was the first time we were passing through a time where we had no get-togethers, no parties, no outings, no religious ceremonies. Common people were globally experiencing a sense of deep emotive instability, transience, and awareness of their mortality. These feelings were amplified by the 24 hours coverage by media and by the daily reports of massive deaths in Italy and around the world. So when COVID-19 started hitting us in March 2020, my unit, which is a 30-bedded medical telemetry unit, was designated as the COVID MedSurg unit of our hospital. And the reason was our floor is parallel to a neuro ICU, which was designated as the COVID ICU. So it was easy for us to transfer patients if they get critically ill to the ICU. So we have private rooms. All those 30 rooms are private rooms. This dropped as a bombshell on us. I was literally scared, like how you all are right now. And so too were my colleagues. Because at the time, we knew not much about COVID, other than these massive deaths in Italy and around the world. Facts and data were still evolving. So at the beginning, having been in contact with this unsuspected COVID ill patient, we have experienced fear for ourselves and our families, a sense of separation from our loved ones, and also fatigue from those prolonged, exhausting work shifts, facing a not well understood virus, its modality of transmission, and the devastating effects. So at first, we thought the route of transmission is droplet. So we were asked to only wear regular mask and gown into the patient's rooms, and also outside the patient's rooms. Like we were asked to wear mask continuously during the work. And then after a few months, we realized that airborne is the route of transmission. So we were asked to wear N95 mask. But then the major problem comes, we don't have enough N95 mask for the staff. So because of the scarcity of N95 mask, after every day of use, we had to drop our mask in a brown bag with your name labeled on it, and we had to send them for sterilization to the sterilizing department. So when you come back the next day to work, your mask is ready for reuse. And we continued that process for a few months until the US was able to overcome that scarcity. So as designated COVID unit nurses, we have experienced a new challenging work environment. In addition to the usual high standard of care we were providing, we were also experiencing and trying to cope with the additional problems caused by the personal protective equipments which were extremely heavy and uncomfortable to wear, especially for long periods of time. And the hardest trial was to offer exactly the same human treatment and care to our patients as we have done before this dramatic pandemic. So the nursing management and the hospital administration, they had to think about practice changes. They had to find innovative ways of doing things to protect the staff and at the same time provide quality care to the patients. So some of the changes or innovations and practice changes that we adopted included, we have divided the hallways into clear risk zones. So we put a red tape in the hallway, dividing into a dirty zone and a clean zone. So within that dirty zone, the nurses could travel or pass from each room, like room to room, without changing their gowns, mask, or shields. But they only had to change their gloves. This was a way of saving PPE, but if you are visibly soiled, then definitely you have to change your gown and all your PPEs. But otherwise, we were changing just the gloves to pass between those rooms. So you cannot cross outside this clean zone into the dirty zone into the clean zone. We also had supplies stocked outside each room that were needed for patient care. So we were not allowed to pull any of those supplies outside from that area into the clean zone. So like we minimally stocked supplies that were needed for patient care. Also, all the rooms, patients' rooms, were temporarily converted to negative pressure rooms by installing a machine to suck the air outside. We had adopted buddy systems to facilitate spotting of PPE, donning and doffing procedures. So somebody will watch you to make sure that you are donning and doffing the PPE in the right way. We had a resource person to assist outside the room for delivering medications or any other supplies that you need additionally after going into the patient's rooms. So we did not want that nurse to doff the PPE and come out of the room. Instead, the resource person will constantly round in the clean zones and ask the nurses for their needs, and she was always assisting them in supplying what they need. We also encourage the nurses to cluster their care. So instead of going in and out of the rooms multiple times, we encourage the nurses to use the call light and call the patient before going into the rooms to ask what they need so that they can gather everything that they needed when they go into the rooms. It saved a lot of time. We had iPads installed in each room. These were actually provided by the physicians. So we had one iPad in each room for the patient. So the physicians used an app called InTouch app. So those patients who does not need to be assessed at the bedside. They use this InTouch app on a laptop from outside the patient's room, and they use that to call the patient through the iPad. So all these ideas were innovations, use of technology, practice changes, policy changes. These all certainly decrease the amount of infection, the amount of exposure among the healthcare workers. At the same time, we were able to provide good care to the patients. So another major hindrance that we faced with the PPE is that it was so hard for us to communicate with these patients. First of all, we have the hood and the mask, and on top of that, we have this negative pressure machine in the room that I mentioned earlier. Those machines were too loud. So we literally had to scream to the patients in order for them to understand us, and it was so hard for them to understand and talk to us. And we had instances where patients' families on the phone, they thought we were rude to the patients because of the way we were talking to them. In fact, we were not rude or angry, but we had to scream to the patients for them to hear, especially if they are hard of hearing. And patients also had a big problem of understanding who's this designated person at their bedside. So hospitals changed their policy on visitation guidelines. There were no visitors allowed for COVID patients during this pandemic, and they had to stay behind the closed doors in the isolation rooms 24 hours. This increased not only the patient's fear of dying without having the chance of seeing their loved ones again, but also originated a fear of a sense of loneliness and depression, and increased the risk of delirium in older people. And even the information about the patient's status, health status, we could only provide them through the phone. So in order to solve that issue, we started using another app called Medical Memory. So with this app, what we did was we record a short video every shift with the patient in the background, and we explain the plan of care of that patient in the video. And if the patients wish to talk, we allow them to talk. And we email this short video to the designated person or family member of that patient. That was a huge help. And the use of cellular phones and tablets were allowed for patients, so that was an important way for them to maintain contact with the patient's significant relations. Now, we have seen patients deteriorating or declining so rapidly, and it didn't matter if they were young or old. So we have seen patients striving to breathe hard even after they walk to the bathroom. Their oxygen demands have tremendously gone up. They couldn't breathe, and they needed assistive ventilation. But we were able to recognize those symptoms, the declining symptoms, so rapidly, and most of the time we were able to transfer them to the ICU before or without coding them on the floor. We had great support from the nursing and hospital administration in getting the physical and emotional support, adequate staffing, bonuses, continuous education and improvisation of practices, employee assistance programs. So those who needed emotional support, they had online programs as well as in-person programs to assist them. We worked together as a team. We were often brought foods and goodies as tokens of appreciation from the hospital administration, employees from other units, families of employees, and we really enjoyed them all. Interesting thing is, one of our patients who was young but obese, we found it really hard to wean him off the oxygen. After a few days, we heard him singing in the room, because we tell all these patients to do the deep breathing exercises using the incentive spirometer. So he was doing that, and he was also singing. We could hear his singing despite all this noise inside the room from outside. And amazingly, he was able to be completely weaned off of O2, and he was discharged home. So we found that music therapy has a positive effect on the humanization of standard care. We also have witnessed patients and families they were forced to make difficult decisions during this pandemic. That's because of their age or multiple comorbidities that they have, or to grant their wish not to get intubated or get treated aggressively. So those patients had to be sent home with hospice, or they were sent to the hospice, or some of them even passed away at the hospital. I vividly remember the son of my patient who was called in to see his mom during the last hours of her life. The moment you need a shoulder to lean on, the moment you need a pat on your shoulder, despite the COVID isolation limitations, I had to hug him in my PPE. It was indeed a sad moment. We only had few of such moments on the floor because we were a med-surg floor and we didn't have any deaths on our floor. And a true sense of satisfaction after the COVID surge is that we had majority of our patients recovered and went home. Now, I want to stress on the personal care that you should be focusing on. No matter how much our tired and exhausted we were, we always made it a point to change our clothes after work in the hospital itself, and those who wished to take a shower had the chances to take those in the hospital. And we sanitized every personal item that we take home every day without fail, and at home some of us even changed again in the garage before we go inside the home, and we go take shower, eat, and rest. So balanced diet, enough sleep, hydration, and relaxation techniques are keys to maintain your physical, emotional health, and also to maintain your immunity. This is very important. So, like I said, hospitals offered psychological support for nurses during and after this unprecedented emergency that we were experiencing. This pandemic had a deep impact on our lives. Like I said, on our personal lives as well as the professional lives. But with the support, love, and care from family, friends, and the workplace, we were able to overcome the fear of COVID. After we had 0 COVID patients, we all went together, like the co-workers went together for a hiking. And we really enjoyed that. So thinking about the future, now we have overcome that COVID surge emergencies. A sense of general hope has occurred in all of us. Now we know how to face this pandemic. We know how it is spread. We have faced enough to overcome any hurdles that may come in the future. We are kind of slowly returning to a normality. To make good use of our experience and learn some important lessons that could help in the future, I will advise you all certain things. First of all, you have to find effective ways to relax daily. So my way of finding my relaxation was to sing and record my songs and post them on the social media. This is important because a relaxed mind boosts your physical health as well as your immunity. And you need good amount of sleep. You know what happens, right? If you don't sleep well. The lack of sleep provides a sense of exhaustion, which is long-lasting and can undermine our professional and emotive performance. And the second thing that I would recommend is to break the chain of stress and find daily time free from digital communication. All of us use almost all social media like WhatsApp, Facebook, news, Twitter, and what else. So find some time free from all those communication methods in order to recover adequate levels of personal energy and detach from the heaviness of the situation. Thirdly, make use of the psychological professional support if they are available. They should not be undervalued, and I deeply recommend that these young nurses as well as all nurses should be provided that psychological professional support by the administration. So we cannot exclude that these kind of emergencies may not or will not occur again in the future. So we should spend time looking for innovative solutions and ways to maintain focus not only on the clinical aspects of these menaces, but also on the humanization features of the care towards patients, families, and also towards ourselves. And I understand that at present you are being prepared to work full-time with patients. Equip yourself with knowledge, and that's your power. Know what you are doing. Find innovative ways of doing things through practice and policy changes. Adopt preventive measures. That's how you're going to lead. That's how your voice is going to lead. Let me conclude by quoting the famous writer Maya Angelou. As a nurse, we have the opportunity to heal the heart, mind, soul, and body of patients, their families, and ourselves. They may forget our name, but they will never forget how you made them feel. I wish you all a bright future, and you all will reach amazing heights with the ocean of knowledge and exposure you are getting currently. Let you be the future of nursing. Let your voice be heard in all innovations in the future healthcare. Thank you once again, and thank you again to all the faculty of Army College of Nursing for providing this opportunity to participate in this webinar. Thank you.